Welcome to Providence Microbiome Research Center. I am Dr. Chandrasekhar, founder and director of Providence Microbiome Research Center Private Limited. We are working on autism and gut microbiome. Our working concept is hologenome theory of evolution. According to our research, human beings acquire few species of microorganisms from mother's uterus. Human body and these microorganisms act as a single unit at genome level, which is referred to as hologenome theory of evolution. When this association between the human body and symbiotic microbes is broken, leads to disease. Antibiotics, pesticides, environmental toxins break this association, leads to obesity, diabetes, cancers, neurodegenerative disorders, psychiatric disorders, etc. When this association is broken in pregnancy, leads to adverse pregnancy outcomes like prematurity, autism, global developmental delay, etc. Around 80,000 industrial chemicals are introduced in last 40 years as per US Environmental Protection Agency. 2,500 new chemicals are being introduced every year. Though most of them are toxic to human body, only 5% are labeled as toxic. Most of these toxins resist human metabolism and accumulate in human bodies. Environmental Working Group and Racial Network did a cord blood study which revealed around 200 toxins in the umbilical cord blood. Microplastics and pesticides, bisphenol A are key components of these toxins. This indicates human embryos are developing in a toxic medium. We hypothesize that these cord blood toxins disrupt the human and symbiotic microbe relationship during pregnancy, which is resulting in gross epigenetic errors leading to autism. Incidence of autism in 1980 was 1 in 10,000. In 2020, it is 1 in 54. There are some predictions that incidence of autism would be 1 in 2 in 2050. So we understood the toxin load in the pregnancies and adverse pregnancy outcomes. We have taken an initiative to develop an antenatal program that will remove the toxins in the pregnant woman, which will allow fetuses develop in a toxin-free environment to prevent autism. We have a roadmap to achieve this goal, where we plan to conduct 2 human studies and 3 animal studies to achieve the goal of antenatal program. So this is the first study approved by the ICMR, and now we started recruiting the patients for this study, and we are conducting this study from March 2022. In this study, we define the epigenetic signatures and gut microbiome profiles of the autistic children, and we assess the clinical outcomes of the fecal microbiota transfer therapy in the autism, and we investigate the causal association between the gut microbiome and development of autism. If the concept is proven, we can develop an effective treatment modality for autism. We can develop an antenatal program that can prevent autism effectively, and we can understand the cause and pathology, etiopathogenesis and pathophysiology of autism, and we can identify the children in the first few months with a serum marker, and we can treat the children in the first early life to reverse the epigenetic errors to bring them to a normal developmental trajectory. So in another planned study, we'll study the newborn child's first past poop and do microbiome studies, and these children will be followed up for 3 to 5 years. Their poop will be tested multiple times in 3 to 5 years to understand the microbial ecosystem development and alterations in the autistic children's gut microbial ecosystem. We also collect the umbilical cord blood of these children and test the blood for the toxins and correlate it with the microbial ecosystem and the overall child development. We also have a plan of animal studies. In one of the animal study, we'll expose the pregnant mice to environmental toxins and investigate the brain development errors in the offspring. In the second animal study, we'll transfer the autistic child's stool or poop into the pair of germ-free mice, and their offspring will be studied for the autistic symptoms and autism and the etiology and pathogenesis of the autism. In the third mice study, we'll expose pregnant mice to environmental toxins and N-acetylcysteine, a detox molecule, and see the offspring developmental outcomes. All these 5 studies will help us develop an antenatal program that will prevent children developing autism. Thank you for time and attention.